So I guess to begin with, then I'll just kind of note that the services provided by St. Clair County CMH are based on a recovery-oriented system of care as developed by Region 10 PIHP across its 4-county region on behalf of individuals who are Medicaid members. Now, access to this system of care is through the Region 10 PIHP Access Center, which provides essential eligibility screening and referral services. Now, according to the National Substance Abuse and Mental Health Services Administration, recovery principles support life and recovery and guide individuals toward a healthier, happier, and more fulfilling life, free of addiction, and accomplished across 4 essential life dimensions. The first is health. And we'll go to that next slide there. Thank you. Which promotes wellness and multi-recovery. Home, which is pertaining to independence and belonging. Purpose, which pertains to personal meaning, self-advocacy, and self-determination. And community, inclusion, and accountability. Now, although many of you may already know what goes into a recovery-oriented system of care, I'd like to make sure that this diverse group of webinar attendees share a similar understanding. And so briefly stated, there we go. There we go. Recovery is holistic to encompass an individual's whole life, including mind, body, spirit, and community. Recovery is person-driven, where self-determination and self-direction defines a person's life goals and unique paths. It also includes the voices and experiences of others in recovery from all ages across the community who can offer the recovering individual additional hope, support, and encouragement. Recovery is also culturally based, which is culturally sensitive, gender competent, and age appropriate. It includes strength-based and trauma-informed services that promote safety, trust, health, and wellness, and are especially coordinated across all service systems, particularly with primary care. And finally, recovery is based on respect and dignity, which includes an acceptance and appreciation for all people affected by mental health and substance abuse problems, which also includes a protection of their rights as well as addressing and eliminating stigma. And so I'd like to offer a brief word on stigma. According to the National Institute of Mental Health, stigma is defined as a social phenomenon that includes negative attitudes, beliefs, and stereotypes about others, such as persons with mental illness or substance use disorder, and views such persons as either contagious, dangerous, or incurable. Stigma sets out to discredit or reduce a person's individuality or identity. Stigma is imposed by individuals as well as by groups. And sad to say, individuals who are stigmatized often end up imposing such stigma upon themselves. Research shows that stigma reduces the quality of life and makes individuals less likely to speak out for themselves or seek needed care. And so our recovery-oriented system of care has been designed and put into place to squarely address issues of stigma. Next, let's talk a bit about the Recovery Substance Use Disorder Services in St. Clair County CMH as applies to the SUD strategic plan. For substance use disorder service, the Region 10's PIHP's recovery-oriented system of care operates within a multi-year plan, which is titled the 3-year strategic plan for substance use disorder, prevention, treatment, and recovery services. The current plan is in place for fiscal years 2021 through 2023. And as noted in its title, is comprised of prevention, treatment, and a full range of other recovery support services for the PIHP's 4-county region, which in this case also includes St. Clair County. And so we'd like to give you a brief overview of how this system of care operates with St. Clair County CMH. First, I'd like to note that St. Clair County has a population of approximately 160,000 persons, 93% of which reside in St. Clair County self-identify as white, 2% self-identify as Black, 3% self-identify as Hispanic or Latino, and less than 2% self-identify as Asian. The median household income in St. Clair County is approximately equal to the overall state of Michigan median income. Also, the range and prevalence of behavioral health conditions in St. Clair County are similar to state averages. The current plan has identified the following gaps of service within the region, and they are access to medication-assisted treatment services, access to recovery coaching services, and access to recovery housing services. And so the current plan has identified a variety of data-driven goals for treatment and recovery services, all of which focus on the need to increase the region's service capacity for medication-assisted treatment and access to recovery housing, access to recovery coaches, access to treatment services and recovery supports for women with SUD who have dependent children. Also including access to treatment services for adults supervised by the Department of Corrections who are returning to their communities, and to continue to combat the effects of the current COVID-19 pandemic. In addition, Region 10 PIHP has identified service engagement issues in the region's rural settings and the stigmas associated with substance use. And these are barriers to treatment within the region. And both barriers are being addressed through the plan's data-driven goals. The plan also recognizes that many St. Clair County residents seeking medication-assisted treatment need bus transportation to the Sacred Heart Center location. And so the plan provides funding for this as well. St. Clair CMH has also recently received PIHP funding to begin offering SUD and MAT services. Unfortunately, there are still a limited number of available physicians to facilitate MAT. Although as noted in the plan, this challenge is being addressed. And finally, the PIHP recently issued a request for proposal to expand outpatient treatment to service capacity. And efforts are underway with Community Programs Incorporated to open a clinic in St. Clair County. Next, let's talk about the access management system. Region 10 PIHP has a contract with the Michigan Department of Health and Human Services to provide administrative oversight and managed care functions pertaining to public mental health and substance use disorder services for individuals who are Medicaid members. Region 10 PIHP includes the following counties: St. Clair, Sanilac, Lapeer, and Genesee. There are 10 PIHPs on contract with the department, each with its own access management system and access center, which must operate according to a specific set of departmental access system standards. Now, during fiscal 21, the Access Center received 21,450 requests for services and completed 14,219 screenings and referrals. 38% of those, or 5,464, were to SUD provider programs. And our operational volume for fiscal 22 is on a par with fiscal 21 numbers. At this point, let's talk about the key functions of the access management system. And they are to welcome all individuals by demonstrating empathy and providing opportunity for persons presenting to describe their situation, their problems, and functioning difficulties, exhibiting excellent customer service skills, and work with the callers in a non-judgmental way. The access management system operates on a 24/7, 365-day basis. An access management system also screens individuals who approach the access management system to determine whether they are in crisis. And if so, ensure that they will receive timely, appropriate attention. We also determine the individual's ability, the individual's eligibility for Medicaid specialty services and supports, as well as My Child, Healthy Michigan Plan, Substance Abuse Block Grant, or for those who do not have any of these benefits as a person who is presenting needs for behavioral health services, make them a priority to be served. The Access Center also collects information from individuals for decision-making and reporting purposes. The center will refer the individual in a timely manner to the appropriate behavioral health practitioner for assessment, person-centered planning, and supports or services. Or if the individual is not eligible for PIHP or CMHSP services, a referral to community resources that may meet their needs. The Access Center also informs the individual about the available mental health and substance use services and providers and their due process rights under Medicaid, My Child, Healthy Michigan, Block Grant, in the Michigan Mental Health Code. Finally, the Access Center will conduct outreach to underserved and hard to reach populations and be accessible to the community at large. The Access Center must abide by the access management system standards listed below to be welcoming, screen for crises, to deal with priority population management, such as those receiving SUD services, determine coverage eligibility for public mental health or substance abuse treatment services, and to collect well, I've already gone through this before, but anyway, as you can see, there are a variety of standards that will have to be addressed in order to make sure that all people receive timely and appropriate referrals. As far as the access screening process, let's take a walk through that. The first step to seeking services is to call the Region 10 Access Center and simply request services. The individual themselves or a parent or a legal guardian must initiate the call. Someone can assist with the call if the person or guardian gives permission to do so. And the phone number to the Access Center is toll-free 888-225-4447. Screenings are conducted by the Access Center during weekdays from 8 a.m. to 4:30 p.m. And after that, calls are routed to our after-hours crisis line, behavioral health response. Mainly, they're there to offer support and assist someone in crisis as needed. Another option for crisis situations is to call 988 directly, which will provide immediate crisis support and linkage. And this was a national support line that went out in terms of a soft launch back in March. This 988 number went national to ensure appropriate suicide prevention and supports for individuals in need. If an individual is in crisis and is calling the Access Center during business hours, they will be immediately routed to a master's level clinician for assistance. The screening process, as I mentioned before, is to take the first step to speak with the access clerk. And that person will essentially ask what the individual is calling for and how we can help. The Access Center does not operate phone trees, and the calls will be answered within a few rings by a live person. If the individual resides in our region, we will seek additional demographic information from the caller. We will request the person's name, date of birth, social security number, insurance information, address, and guardian or parent information, as well as identify if the individual is part of a priority population. That is, pregnant female, someone recently discharged from Michigan Department of Corrections, or maybe an IV drug user, or a parent at risk of losing the children. Now, the access clerks can handle and process requests for outpatient and intensive outpatient SUD services, making it a rather brief and expedient request for services and moving the person on to referral. If the caller is seeking a higher level of SUD services, such as subacute detox, residential services, methadone or other medication treatment, assisted treatment services, or CMH mental health services, these calls get routed at that point to the next available clinician to complete an eligibility screening determination. The clinicians in Access are all master's level clinicians prepared as licensed social workers, psychologists, or counselors. The screening with the Access clinical staff will take about 20 minutes. The clinician is seeking information in a number of areas to sort out the needs of the person, as well as their history of prior treatment. The Access clinician will ask a number of questions, including current needs, current symptoms and functioning, support system, medical issues, prior treatment history, family mental health or substance use history, risk of harm, lethality assessment, mental status exam, and so on. The Access clinician will notate a preliminary diagnosis at the end of the screening process. If eligible, a referral will be made to a provider in network within the region. Typically, CMHs only serve the most severe mental health clients that require specialty services, and those that have mild or moderate symptoms will be referred to a provider in the community that can work with their Medicaid health plan or their private insurance, or a sliding fee scale if no insurance. But because St. Clair CMH is a CCBHC certified Community Behavioral Health Center demonstration project, it can provide services to all individuals with mental illness and substance use disorders, including those that have more mild and moderate conditions. Next, a word on the ASAM part of the SUD screening process. For those seeking SUD services, the access clinician will complete an ASAM level of care determination based on criteria developed by the American Society of Addiction Medicine. And the levels of care are 0.5, which is early intervention, level 1, which is outpatient treatment, level 2.1, which is intensive outpatient services, consisting of at least 9 and no more than 20 hours per week of treatment. Level 2.5, which is partial hospitalization, which is at least 20 hours a week, but is less than 24-hour care. Level 3.1, which is clinically managed low-intensity residential treatment. Level 3.3, which is clinically managed high-intensity and population-specific services. Level 3.5 is clinically managed residential services. Level 3.7, which is medically managed high-intensity inpatient treatment. And level 4, which provides 24-hour nursing care or daily physician visits. Now, these levels of care also reflect the various levels of need as identified in the ASAM Comprehensive Assessment Tool, which was put into operation at the beginning of this fiscal year. There are 6 dimensions of the ASAM that are documented by the Access Center when determining medical necessity for SUD level of care. And these 6 assessment dimensions are alcohol, intoxication, or withdrawal potential, biomedical conditions and complications, emotional, behavioral, or cognitive conditions or complications, readiness to change, relapse, continued use, or continued problem potential, and recovery environment. Now, as aligned with the ASAM system, the Region 10 PIHP SUD provider network is comprised of 6 levels of care to ensure a comprehensive range of services for persons needing SUD treatment. And these 6 levels of care are outpatient services, intensive outpatient services, medication-assisted treatment, subacute detoxification, short-term and long-term residential services, and recovery housing. Now, the Access Center SUD screenings are completed during regular business hours. But recently, the Access Center has expanded its hours of operation in partnership with 2 of its SUD residential providers to ensure evening and weekend coverage for screenings, referrals, and authorizations. And if time allows, we can discuss that near the end of our presentation. Now, a word about the access, denial, and second opinion process. If someone is denied CMH or SUD services at the time of access screening, the individual has a right to request a second opinion screening. The second opinion screening is completed by a different master's level clinician than with the first clinician that denied the service eligibility. The person can just call Access and request a second opinion screening, and this will be scheduled at a particular mutually agreed upon date and time. Individuals who are Medicaid members also have rights under Medicaid to seek an appeal through the Region 10 Customer Services Department. If the result of that request review is another denial, the person has a right to seek at the state level a Medicaid fair hearing with an administrative law judge. The Access Center also has the duty to inform people of their rights under the Mental Health Code. We are often asked whether a person must have to have Medicaid to receive SUD services, and the answer is no, you do not. But if someone has private insurance, we must only refer to SUD agencies in our network that will be able to bill that particular private insurance. Now, if someone has private insurance and has a copay or deductible or has no insurance, there are block grant funds that can be utilized to supplement payment for services. But it should be noted that the individual must provide income information at the time of intake in the SUD provider location to determine what amount can be utilized to cover based on a fee determination. Now, if someone has no insurance, the person should be assisted with applying for Medicaid. If someone recently moved to our region or has Medicaid coverage from another county, we will ask to work with them, with DHS, to get this changed to their current county resident address. This relates to the county of fiscal responsibility, or coffer, and if time allows at the end of the presentation, we can also talk about that briefly. Now, the Access Center must link individuals with services within 14 days of their screening for routine mental health screenings or routine SUD screenings. If someone is coming out of inpatient psychiatric care, they must be linked within 7 days of their screening with the Access Center. If someone is coming out of subacute detox, they must be linked also within 7 days of their screening. If someone is a priority population individual, we must follow the guidelines for linking with a SUD appointment. For example, a pregnant female seeking SUD services must be screened and referred within 24 hours. Next, we'll take a look at the SUD providers in St. Clair County. And what we have here is a list that goes a couple of pages, just to let you know that to be aware of all those particular programs. Catholic Charities of Shiawassee and Genesee, Southeast Michigan, community programs also doing business as Meridian Health Services, Flint Odyssey House, which also has a location in Port Huron, Lapeer County Health Department, which is the Alcohol Information Counseling Center, List Psychological, New Paths, Sacred Heart Rehabilitation Center, which has offices in New Haven, Algonac, and Port Huron, Sanilac County CMH, and of course, St. Clair County CMH with their offices in Port Huron, Capac, and Marine City. Next, a word about detox and residential providers. We are also referring then to Community Programs Incorporated, otherwise known as Meridian Health Services, that operate out of Waterford, Flint Odyssey House, Great Lakes Recovery Center in Negaunee, New Paths also in Flint, Sacred Heart Rehabilitation Center, which operates out in Richmond area, as well as in Berrien County, and Salvation Army Harbor Light in Clinton Township. As you can see, some of these service providers are outside the region, but as available and as requested, referrals can be made for those St. Clair County residents. Also taking a look at methadone or medication-assisted treatment services, we see that Biomed operates out of Flint and Roseville for methadone, and that Sacred Heart Rehabilitation Center also operates a methadone clinic at its Richmond location, Madison Heights, and Flint. For medication-assisted treatment, we also have St. Clair County CMH as a provider, and New Paths Flint as a men's location services. There's also naloxone services operating out of Genesee Health System, known as Genesee Community Health Center. In terms of recovery housing, there's Flint Odyssey House, again, which operates out of Port Huron as well as Flint, Sacred Heart Rehabilitation Center's office in Port Huron, and New Paths operating out of Flint. Recovery coaching is across a wide range of multiple providers and locations. Next, to look at recovery support services. As you can see, we won't go through all the numbers here, but we're looking at Blue Water Recovery Outreach Center, Vision Quest, Dry Dock Recovery Room, Families Against Narcotics, the Michigan NA Helplines for Michigan, as well as Metro Detroit. From there, let's take a look at the CCBHC demonstration project per se. Again, I realize that some of you are more than aware of what the CCBHC is about, but I'd just like to kind of briefly go through it for the benefit of our diverse audience so that everyone kind of has the same understanding of what that is. As noted in the CCBHC handbook issued by the department, the St. Clair CCBHC demonstration project is essentially an expansion of their current person-centered, family-centered, trauma-informed, and recovery-oriented system of care, which is designed to integrate physical and behavioral health care and thereby serve the whole person. In other words, the CCBHC model reflects the region's recovery-oriented system of care. This system of care also includes substance use disorder services as provided within the St. Clair CCBHC demonstration project. And so persons with SMI who also have a co-occurring substance use disorder will access SUD services through the Region 10 Access Center screening and referral process, as I've mentioned before. And that also pertains to those requesting SUD treatment only. Care coordination is central to the CCBHC model. And all CCBHCs are required to build a comprehensive partnership with health and other social service providers as formalized through care coordination agreements. CCBHCs are also responsible for a wide range of evidence-based practices in psychiatric rehabilitation services, along with peer specialists, recovery coaches, peer counseling, family and caregiver supports. Many of these evidence-based practices are geared toward persons with SMI who also have a co-occurring substance use disorder. Additional psychiatric rehabilitation services are also made available on an individual basis, which include medication education, self-management, training in personal care skills, individual and family caregiver psychoeducation, community integration services, recovery support services, including illness management and recovery, financial management, and dietary and wellness education. Also encouraged are support services such as housing and employment services, such as the individual placement and support model of supported employment, of which I'd like to kind of point out that St. Clair is a state leader with regard to IPS services. Now, just a brief word on St. Clair County CMH crisis services. I just wanted to kind of mention the basic point here is that persons who self-identify as being in crisis or identified by others as apparently being in crisis will receive community-based CMH crisis services as appropriate without prior authorization from the Access Center. And for persons in crisis who may need inpatient psychiatric treatment, the Access Center typically works in partnership with St. Clair CMH on the pre-admission screening process and is appropriate with admission to the inpatient psychiatric unit. For those persons screened for an IPU admission who are at times under the influence of substances, medical clearance must, of course, first be obtained in order to complete the screening and authorization process. Finally, just wanted to mention a brief word on the opioid health home. That is something that has been put into place through this current fiscal year. Just to mention briefly then that most of us may know that opiates are narcotic sedatives that depress activity of the central nervous system, reduce pain and reduce sleep. And examples include morphine, methadone, codeine, heroin, fentanyl, oxycodone, and hydrocodone. Prescription opiates can be prescribed by doctors to treat moderate to severe pain, but these medications can also have serious risks and side effects. And common types of prescription opioids are oxycodone, hydrocodone, morphine, and methadone. Fentanyl is a synthetic opioid pain reliever. It is many times more powerful than other opioids and is approved for treating severe pain, typically for advanced cancer pain. Over the past decade, I'm sure many of us have already realized that illegally produced and distributed fentanyl has been on the rise in several states, including Michigan and in our region. Heroin is another legal opioid. 36 people die every day from heroin overdose in the United States, and these numbers are even greater for fentanyl-related deaths. And so Region 10 has undertaken 2 initiatives to help address the opioid epidemic. Over the past 4 years, Region 10 has facilitated and supported local distribution and utilization of Narcan as a first response to fentanyl overdose. And at the beginning of fiscal 22, the PIHP also put into place the department's opioid health home benefit. Implementation of the opioid health home benefit complies with applicable federal regulations, as well as requirements in the Michigan Medicaid State Plan Amendment and the department's opioid health handbook and related departmental policies. Now, simply put, an opioid health home is a comprehensive care management and service coordination system serving qualified Medicaid beneficiaries who've been diagnosed with an opioid use disorder. The emphasis is on maximizing an individual service engagement and treatment response to opioid use disorder clinical best practices, with individualized supports toward a continuing recovery. Now, an opioid health home operates in partnership with the PIHP to ensure that all opioid health home requirements are met and that all special service monitoring and payment structures are in place. An opioid health home provides 6 core health home services as defined in the handbook. And these are comprehensive care management, care coordination, health promotion, comprehensive transitional care, individual and family support, including authorized representatives, and referral to community and social support services. Now, for St. Clair County, the Sacred Heart Rehabilitation Center in Richmond is the Region 10's opioid health home, serving Medicaid members. The Sacred Heart Regional Center in Flint also provides opioid health homes within the region and potentially could be available for referral. So that kind of takes us through the slides. And how are we fixed for time, Adrian? Okay. What I'll do is just take a quick moment just to elaborate a little bit on a few other things that are taking place in the region, and be happy to open it up for questions from there. During this year, Region 10 PIHP has chosen a new regional performance improvement project for the 4-county region, which of course includes St. Clair County. And it's intended to address racial and ethnic disparities in the access, referral, and service engagement process. This is something that through the region has various impacts, all of which are negative. And we want to address them on a local basis across each of the CMH affiliates. We are in the planning stage based on root cause analyses that we've been conducting these past 5 or 6 months to really identify where the gaps are or where the barriers are. When someone is calling for service, they may get the referral, but somehow they don't quite make it to that first appointment. Or they may make it, but at a later date. But there's a crack in the system, so to speak. And so that is going to be addressed with implementation planning that'll be completed at the end of this calendar year, and that will begin in January. So to that extent, we're looking at kind of a 2-pronged approach, that there may be issues particular to racial minority groups that need to be addressed across each location, as well as to see that there may be other kinds of broad system design opportunities throughout the region for all racial and ethnic groups that will be as a rising tide raising all ships. So we'll keep you posted on how that will play out for St. Clair County, as no doubt some of the SUD programs providing services in the county will be partnered for that systems improvement activity. Next item is that the Access Center has also recently implemented an after-hours residential detox screening, evaluation, and referral program. And right now we're partnering with Flint Odyssey House and New Paths, both of course located in Flint, to work beyond the 4:30 to 5 o'clock, after 5 o'clock non-traditional hours. So we're including 5 p.m. to roughly midnight weekdays, as well as then 12-hour business days on Saturday and Sunday, which are aligned with those provider programs non-traditional hours. And so the idea is that when a person is requesting services, whether they may call BHR or call a particular program that we're partnering with, we'll be able to link these people up with a real-time clinical screening and referral and authorization at that point. So virtually we're looking at a 24/7 operation for after-hours screening for SUD residential services. And we are in our second month of implementation. The August monitoring report was submitted to the region's Utilization Management Committee for review. And so we're initially again tracking those numbers having to do with access requests and screenings and referrals, tracking the kind of volume that we're having across weekday after hours as well as weekend activities. and are essentially taking a monthly monitoring for the remainder of this calendar year, just to make sure we're tracking what has gone well, what needs improvement, and what are next steps. So far, things have gone rather well during the month of August, and we're looking forward to looking at our data for September to see how those first 2 months are working out. One of the final point that would be relevant to this presentation is to note that beginning in October for fiscal 23, the access management system will be centralized. It will be at the Port Huron location only. We're phasing out the Flint access operation. And so all calls will go to the Port Huron Access Center. And we're looking forward to that. It's going to be a challenge as well as a real opportunity to ensure consistency and timely access for all persons in the region, especially those, as we're noting here, serving or receiving services or requesting services in St. Clair County. So lots of change in the air, all incremental improvements toward an improved access management system. That concludes the presentation. And if you'd like, we're open for any questions.
Sounds good. And true technological style, like I said, just because we're being a little flexible today, we are going to go ahead and just scoot our screen over. If you could give me a second, I'm just going to check real quick for Tom to see if we have some questions. So if you could just give me a second here and we'll check on this and see. A lot of information, Tom. Very appreciative. I know I've been working for CMH for several years, a lot of even really good information for me as well, too, that I've learned. So I appreciate that greatly. All right. One of the questions, Tom, and I'm not sure if I'm going to go over a couple, was are veterans eligible and what does eligibility for veterans look like? So I will turn it back over to you for that one.
Okay. Yes, specific to St. Clair County, being a CCBHC demonstration project, services are available to veterans residing in St. Clair County through St. Clair CMH. That has been a need that has been identified for many years, and that we're happy to see that has been integrated within the recovery-oriented system of care. We already know only too well that upwards of a quarter to, if not to a third of all veterans who had served in theaters of combat have come home with PTSD or post-traumatic stress disorder issues. These are the wounds that we can't see, but are just as real. And so the range of CCBHC related services are quite appropriate and aligned well with those particular service needs. Also like to recognize the Veterans Navigator activities that take place regionally, as well as with St. Clair's local Veterans Navigator, to make sure that recovery from those internal wounds also relate to or are receiving appropriate other veterans benefits and other support services for them and for them and their families.
All right, I'm just kind of double up our screen right there so we can see a little bit of myself and Tom. A lot of good stuff. It sounds like really a lot of changes going on within the access system. I think it's great information for folks to know. A lot of people, even if they've been stakeholders in the community for a long time, wonder a little bit more about how does the access part work and the eligibility for services. And I think that you really helped shed a lot of light on that today, as well as some upcoming changes and projects. So a lot of stuff going on within the region, which is great. So thanks for joining us, Tom, today. We greatly appreciate it. So we're going to wrap it up today for our presentation. Just to remind everyone, we still have 1 week of presentations next week. If you go on the SCCCMH.org website, you can see the presentations that will be taking place next week. I know on Wednesday, I'm very pleased that I get to shift from a role as a moderator and present on motivational interviewing when it comes to engaging for substance use. So hopefully I'll see some of your names on Wednesday. So with that, on behalf of myself and Tom, we'd like to say have a really nice rest of the weekend. And thanks for tuning in today, folks. Bye-bye.